Boa noite. A pandemia ela tem exposto muitos sistemas de governos para lidar com a questão da saúde, desigualdades sociais e também alguns têm dito que envolve a questão dos desequilíbrios ambientais. O que você pensa a respeito?
Well, I think the imbalance has been very obvious. Places that have been the worst affected are places where there has not been a clear national program and a clear health service. This is the way to handle the pandemic, is to really have a working government and have a working task force that can handle these issues at a national level. It cannot be piecemeal or patched together. Even countries like the United States, where there's a lot of resources, are struggling, especially because our system of healthcare is not regulated at a national level, and because we are a federation, states have a lot of control, individual control about what to do and what not to do, and that has not worked in our favor in the United States. To give you one example, individual governors of individual states have a lot of discretion around what to do, whether to open schools, to open businesses, to keep businesses open, how severely or how much they will intervene on people to keep masks on and keep public safety measures on. In the United States, that has been relegated to individual states. And if you don't have a national policy, and if it's not consistent, that becomes a huge problem. In the United States, again, we've seen that people who don't have access to information, people who are living in crowded conditions, people who are frontline workers, and people who don't have adequate protection using, for instance, masks, there is now growing evidence that these people are disproportionately affected. And in fact, in the United States, African Americans and Hispanics have been disproportionately affected by coronavirus. And it's an instance of the political and public health mayhem that happens when you don't have a centralized system and have a decentralized system, which allows individual governors in individual states to make individual decisions. The countries that have done well in comparison have highly centralized systems. They have imposed lockdowns, and they have really imposed very strict lockdowns, often under supervision by the army or the military. They have imposed strong travel bans, especially from other countries where the infection load is very high, and they have really imposed strong quarantines. And there has been a consistent message, not a diffuse message across. So what we are seeing here, I think, is an example where to attack a pandemic, you need a supervised task force and not a patchwork or a diffuse system which doesn't work.